Lehigh Valley Health Network might go out of network for thousands of people. In Pittsburgh, officials had a naloxone vending machine installed. Here's what'll happen if you don't have a real ID at the airport. Lastly, a paranormal activity roundup. I'm Claudia Dimuro, and you're listening to Today in PA. After 2 years of failed negotiations, Jefferson Health's Lehigh Valley Health Network is expected to go out of network for people with United Healthcare's Medicare Advantage plans on Monday, reports the Philadelphia Inquirer. More than 20,000 people will be affected if a last-minute deal isn't reached. According to a statement from Jefferson, United reduced payments to LVHN by almost 40% since 2021, which reduced the nonprofit's revenue by more than $100 million over a 4-year period. Jefferson first sounded the alarm that this would happen in October, just a few months after it went out of network with Cigna for a few weeks during a similar impasse, something which this podcast covered. But a deal on that was eventually reached. LVHN patients who have United Healthcare plans through their jobs will remain in network through most of April. This also doesn't affect Philly area Jefferson patients with insurance from United Healthcare. Said Jefferson Senior Vice President Jeffrey Price, quote, "When an insurer stops paying agreed upon rates and refuses to negotiate, patient access is put at risk." The Allegheny County Health Department had a naloxone vending machine installed in downtown Pittsburgh, reports the Tribune Review, right outside of the Allegheny County Human Services building. The idea with this is to make the opioid overdose reversing drug available for free in a place people might be comfortable getting it from. Officials explained that sometimes people might feel discouraged getting naloxone from a pharmacy or a store because of the stigma attached to it. Others might not be too keen on the $35 to $50 price tag. This machine is one of several installed thanks to the CDC's Overdose Data to Action grant. Overdose fatalities have been on the decline countywide over the last 3 years. As a reminder, since it's getting close, if you're headed to the airport next month and you don't have a real ID, here's what'll happen, states PennLive. Starting February 1st, people without an acceptable form of ID will have to complete an identity verification process before entering a TSA checkpoint. This will cost you $45, but you'll get a TSA Confirm ID, which is valid for 10 days. However, if your return flight doesn't fall within that 10-day period, you'll have to do this whole process over again. If you do return within that 10-day period, you're golden. Fortunately, you can go through all this and pay the fee before stepping into the airport. If you're interested in that, please click on the corresponding podcast article link. Pennsylvania residents purportedly, quote, reported numerous close encounters, unquote, with the paranormal last year, says PennLive. In a post published to his website this week, Stan Gordon, who's dedicated his life to the unknown in Pennsylvania, says 2025 was quite the year for sightings of Bigfoot, aliens, and the like. UFO sightings by far seem to be the majority of these reports, followed by Bigfoot, who one witness said they supposedly saw sitting on a tree stump in Derry Township. But there are other odd sightings too. Thunderbirds, a dog man, weird human-like creatures with wings, and something that looked like a deer without a face or ears that vanished into thin air. As for what kind of weird stuff 2026 will bring, well, I guess we'll just have to see. That's all, folks. For more news, drop by PennLive.com. Also, please don't forget to rate this podcast and to let me know what you think in the comments or at todayinpa at PennLive.com. Thanks ahead of time, and as always, thanks for listening. I'm Claudia Dimuro, and see you for Friday's episode of Today in PA.